This lecture will describe the assessment and prescription of physical activity and exercise for older adults. This slide describes the challenges that can occur just in trying to complete daily activities for this population. The important component of this is that inactivity can be a killer for the elderly, and ultimately that's what we are trying to avoid by prescribing exercise and physical activity. It's important to remember that elderly is an imperfect term because it is not a uniform progression of aging, and that it is going to change based on individual characteristics of each person within this population. Typically, we use the term older adults just to describe an age range rather than an aging process. Now, aging is inevitable, but the rate and the magnitude are modifiable and sometimes even reversible with the appropriate exercise intervention. You do need to be aware of any disease processes that are involved with any clients that you have in this age population, and they tend to be more prevalent. In this slide, you can look at all of the different physiological variables that are affected by exercise. And what you'll notice is that typically the change as people age is in the direction that decreases function. Now, there are a lot of benefits of being physically active. It will certainly slow the process of aging, and it will increase exercise capacity. It'll improve body composition and provide a greater sense of well-being by helping mental function and cognitive function. It's a great way to manage chronic illnesses, and it reduces the risk of physical disability. And ultimately, it will increase longevity. This slide indicates the amount of physical function as people age. And what you can see is that typically at lower ages, there's not as much function. It's going to peak in the early 30s and then decline over time. But what you'll notice is for those people who are active, they will outperform their inactive peers at any age all across the lifespan. Now, in this slide, when we look specifically at VO2 max, you'll see that there is a reduction in VO2 max as people age, and this is the typical slope for that for sedentary adults. Now, if you look at active adults, they are going to decline as well, but the pivotal point in that decline is going to be closer to age 60 rather than age 40. Now, if these sedentary adults around this time decide that they want to become active, they will increase the amount of activity that they have a capacity for, but they'll never be able to achieve the same levels as those who were physically active across the lifespan. Another physical change that's associated with aging is a loss of muscle strength, and this is related to fewer muscle fibers, decreased cross-sectional area, and both of those are going to result in a decreased strength. Now, it's not clear if physical activity and exercise can slow the muscle fiber loss with age, but it has demonstrated that physical activity and exercise can retard the loss in the cross-sectional area. And this is a chart that kind of demonstrates the difference between the young muscle and an old muscle. And it indicates that exercise will have an impact on changing all of the components that move a young muscle into an old muscle. And those include changes in the blood composition, changes in the protein balance, changes in muscle stem cells that allow for rebuilding, and improvement in maintaining the number of mitochondria, which are essential if we want to be able to maintain the capacity of a muscle. Now, ultimately, it's always the idea that you're wanting to improve quality of life. And so here we can see that quality of life is much higher and it stays longer in physically active. Now, for this group that was sedentary, if they start being physically active, again, they're going to be able to improve their quality of life, but not to the extent as those who were active across the lifespan. As far as exercise testing, is most will not require exercise testing, and you can follow the guidelines set for adults. Now, you do want to make sure that you assess cardiorespiratory fitness, and if you are going to, then you may have to adapt the protocol based on the capacity of your client. There are a wide selection of protocols that have been standardized for this population, or you can use other protocols just with slight modifications. And the protocols are available for those who would fit into a highly deconditioned or very physically limited population. Now, for the oldest segment, those who are 75 years or older, or those with severe mobility issues, there are some recommendations. You would want a thorough medical history and physical exam. You would want to stratify those with cardiovascular symptoms or those that are diagnosed with it. And those free of cardiovascular symptoms or disease may be able to go ahead and participate in low intensity physical activity programs or exercise, and that's less than 3 METs, and that's without really any undue risk. And here is an article that describes the supports that concept for screening. And if you're interested, we can get you copies of this, or you can look it up in the library. Now, there is no specific test termination that would be specific to older adults. You can pretty much follow the standardized test termination. However, most of these tests will be terminated earlier just because they're going to reach their capacity faster. Typically, you'll see lower peak VO2s, and you may see an increased prevalence of cardiovascular, metabolic, and orthopedic problems. And all of those can have an impact on what you would be able to see in their VO2. Now, for those that are pretty healthy, you may see older adults that are going to be able to exceed their age predicted heart rate max. And if you're pushing them to the max, that should not be a surprise. So here are some of the links for some of the commonly used tests, and all of these are pretty easy to implement, and they're readily available. So if you find yourself needing to test this population, save this as a resource and feel free to use any of these assessments. Now, some things to consider is that many people in this population will have low functional capacity, muscle weakness, and deconditioning. And all of that will contribute to a loss of independence. And many times that's the motivation that people have to become active, is that they want to be able to maintain independence for as long as possible. And in order to do that, a comprehensive exercise prescription should include aerobic training, muscle strengthening, flexibility training, and balance training. And these two are the areas that are somewhat unique to this population. You would not see these included in an exercise program typically for healthy adults or for pediatrics. So for aerobic activity, you want a minimum of 5 days a week. You would like to have moderate intensity, 3 days for moderate intensity, or 3 days a week for vigorous intensity, or some combination of those. And on a 0 to 10 scale, you want to try to achieve a 5 or a 6 for moderate intensity, or 7 to 8 for vigorous intensity. And here is the scale for monitoring perceived exertion. Now, your prescription should try to accumulate at least 30 to 60 minutes, and you want bouts of at least 10 minutes. And this hopefully will total 150 to 300 minutes. Or if you're going to go with vigorous intensity, you can go with 20 to 30 minutes in trying to achieve 75 to 100 minutes per week, or some equivalent amount if you combine moderate and vigorous activity. In any modality that does not impose excessive orthopedic stress, things like walking, aquatic exercise, or cycling are good choices. And you're wanting to avoid orthopedic stress so that you don't wear the joints out and cause some type of injury or exacerbate arthritis that will prevent them from being physically active. You want to encourage them to meet the population-wide recommendations, and you can give them some options like brisk walking, gardening, yard work, housework, climbing stairs, or any kind of active recreational pursuits. And this can include things like fitness classes at local fitness centers or YMCAs. And here is a supportive article that talks about including resistance training in this population, because that's important in maintaining independence as well. Now, if you have somebody who is a frequent faller, that can have an impact on how much resistance training can be done and will need to be part of any assessment prior to doing resistance training. Now, a typical assessment that's used with this population is the BBS, and that's the Berg Balance Scale. And there will be a link to this in this section of the course. And what you want is to try to improve balance, and that will include agility and proprioception. And I want you to research what some of these activities are. We're going to talk about this some if you watch the video for the case study on older adults, but you should see what people are interested in and then do a little bit of research to see if you can find what types of activities you should include in your program. And if an older adult cannot attain these recommended amounts of physical activity, then you want them to be as physically active as possible. So for the resistance training, you want it to be at least 2 days a week, and you want it to be between a moderate and vigorous intensity. And again, this is using the scale of 0 to 10. And any type of progressive weight training program will be appropriate. This kind of goes back to the slide that talked about the progressive loss of strength with aging, and that impacts level of independence. So this resistance training is an important part of a comprehensive program for this population. Now, you can apply the guidelines for healthy adults. You do want to make sure that you supervise at least the initial training sessions to make sure that they have the appropriate balance and that they're completing the exercise appropriately. And you want to start fairly slowly. So during the first phase of it, you want to use minimal resistance and look to see if they're making adaptations. Typically, you want sets of 8 to 10 exercises that use all the major muscle groups, and a set should include 10 to 15 reps, and you do want to stay within that exertion of 10 to 7. You want to start at about 50% if a person has had to be off of exercise for more than 3 weeks. And you want to maintain normal breathing patterns while they're exercising and try to control momentum as much as possible. You want to avoid any type of explosive activity that could lead to a potential injury. You want them to move completely through their pain-free range of motion and use multi-joint exercises if possible. Weight machines are fine. It's a great way to make sure that no weight is dropped or injured, or that they're injured in any way. If you are going to use machines, you do want to provide plenty of time for them to adjust to the postural changes between the pieces of equipment, or even just between the exercises. And it's fine to use routine daily activities for improving muscular strength. Now, if they're in a time of increased inflammation or pain, you want to limit the amount of resistance training that they're doing. Now, the other thing that's important is to encourage year-round activity. If some of their exercise is doing something outside, you'll need to accommodate for that during the winter months. Now, as I said, flexibility is a big part of this, and flexibility typically declines with age and will result in limited functional capacity. So you want to try to do flexibility training at least 2 days a week, but even every day of the week would be better. You want them to stretch to the point of feeling tightness or slight discomfort and to hold the stretch for 30 to 60 seconds. So you're avoiding quick stretching. In any type of activities that maintain or increase flexibility, using sustained static stretches for each major muscle group are great. And if possible, you would want to include it in every exercise session. Now, for those where decreased flexibility is their primary concern, that may need to be the entire exercise session, at least at the beginning of training. Balance exercises should be included as well. And you can do anything that progressively challenges their balance. And these are going to be things that will slowly reduce the base of support. The idea of balance is that your center of gravity is maintained over the base of support. So as you reduce the base of support, then you are increasing balance. So that's always going to be the goal. You want it to be dynamic movements if possible that will help move the center of gravity. And since most functional activities are dynamic, that would be the best approach. You want to cause some stress to the postural muscles because as those get stronger, the balance will improve. Now, just remember that for this population, many of them have decreased sensory system functioning. So things like vision and hearing may be reduced, and those can have an effect on balance as well. So take that into consideration as you're planning different types of activities. Tai Chi has been researched as a great way for this population to experience some improvements in balance. Now, some things to consider is that you might want to start with a low initial intensity and duration and then progressively increase, but to be conservative and cautious. You want to do strengthening exercises, and sometimes those may be what you have to start with. If strengthening is the primary issue that they're having, they may need to develop some strength before they can move on to other things. And well, this is what we just said, is that sometimes the strengthening needs to precede aerobic training if the people are very frail. What you're hoping is to gradually exceed the recommended minimum amounts of prescribed activity. If they have a chronic condition that doesn't allow them to achieve the minimum amount of activity, then you want them to be as active as possible. The idea is, as much as you can, avoid the sedentary behavior. To improve many of the chronic conditions that this population experiences, it is recommended to exceed the minimum amount. So you want to encourage them to do as much activity as possible. And if you can incorporate behavioral strategies into the programs, they're going to be more successful. And those would be things like exercising with a partner. Isolation is a big problem for this population, and they do seem to adhere more to physical activity programs when there's a social component of it. And make sure that you provide regular feedback and give them as much positive reinforcement as possible to encourage continued participation. Now, a lot of research has been done in this area, and it is a constantly growing population. And if you have an interest in this, you'll certainly be able to have some job security. So I've provided some abstracts from some of the research that's been done that hopefully will support some of the ideas that we've presented here. One of the things is that exercise will have an effect on cognitive function, and some evidence suggests that exercise is better at preventing the cognitive decline, or at least slowing it down, particularly in terms of Alzheimer's disease, better than any of the medications that are currently available. This is one that indicates the benefit of exercise on decreasing the fear of falling and reducing falling risks for the older adult population. And here's one that looked at being able to maintain muscle strength in the older adult population. And then one just on maintaining physical function. So as you can see, there is a lot of evidence that supports the use of exercise as appropriate interventions to improve function as people age. And that is the end of this presentation.